We good. We're recording. Fantastic. Hey guys, I'm Dr. David. We're going to be talking about my secret method to improve knee arthritis immediately and for the long term. My name is Dr. David. If this is your first time joining us, I'm a physical therapist. I specialize in helping people avoid unnecessary surgery and get back to being active again. Get your life back. Do the things that you love to do. Everybody that's joining us live right now, guys, let us know where you're from. Type in the comments here. We can see the comments. You might see me look this way because I'm looking at the comments. Let us know what part of the world you're in. We always have people from all over the United States, thankfully, but we have people coming in from Europe, from Australia, from Africa, from different parts of Asia as well. Who is with us right now? You guys chime in. Let's take a look at the comments here. We already have questions. Mina16 is asking a question. We'll get back to it soon. Oh, A. Grabner just became a YouTube member. If you're interested in becoming a channel member, which is on YouTube, this is not our programs, but if you're interested in becoming a channel member, you get priority. We prioritize answering your comments on YouTube. So that's if you have a question or something, we do our best to answer it as best we can over comments. Of course, it's not the same as like joining one of our programs where we get to interact live over Zoom. Who else is with us here? Juliet Parker from Sydney, Australia. Hey, Juliet, I remember you. Welcome back. Thanks for joining us. Susan, I'm getting pseudo knee locking. It's extremely painful. What can I do, please? Sue is in the UK. Oh, that's tough when the knee joint starts to lock. It's a little far gone. There's a lot of things to do. We'll actually be touching base on it in this talk here today. BHA 2025 says she's in the South. He or she's in the Southeast Coast. Fantastic. Raymond Mann is in the UK. Very cool. UK is always well represented here. Bella Maldonado. I think I remember you, Bella. She says hello. Kimberly's here. She says, hi, Dr. David. Welcome back, Kimberly. Julie says, I have to pull myself up the steps by the railing. Oh, I'm so sorry, Julie. You got some strengthening to get. Texas TXP Shooter says, Katy, Texas. Awesome. Other side of the state from us. We're in El Paso, Texas right now. John Carter is in St. Mary's, Georgia. Hello, John. Welcome. Thanks for joining us. Gila Gale says, hi, Dr. David, UK. Thanks. Oh, awesome. Thanks for joining us, Gail. Esther, I can't pronounce that, Korzen says, listening from Cape Town, South Africa. There's Africa in the house. Fantastic. Glad you're with us. Julie Parker gives us a heart. And then Bella says it's Renee from Sacramento, California. Awesome. Hey, Renee. Thanks for joining us again from the West Coast. Hello from the Buckeye State. Lori Wilson's in Ohio. Fantastic. And then Anna Becking is in Vancouver Island, Canada, all the way up north, our neighbors up north. Fantastic. Melbourne, Australia, that's where Mighty Blues is. Great. Jay Cruzio is in Southwest Virginia. East Coast is in the house now. Thank you guys. Thank you guys so much for chiming in. We've got a great talk. So I'm going to be talking about my secret method to help knee arthritis, to improve knee arthritis. And I got a lot of great information for you guys. We'll also be taking some calls today. So stay tuned. Pay attention to when the helpline is visible here. And we want to take some calls. I want to talk to some people live on our live stream here and be able to answer a question for you and see if we can get you unstuck in your process in your journey going through our process, our method to fix knee arthritis. So let's get going with this here. The secret method, I'm going to lay it out for you. And it's, let me just give you this caveat right now. It's not a specific exercise. It's not a treatment that is new and researched necessarily. It's not a gimmick or a trick. And it's more of a process. It's a way of thinking. It's a mindset. And this is what's infused into our knee arthritis recovery program. And I talk about it at length here, but I'm going to break it down for you in a way that hopefully is much more digestible, because what a lot of people are looking for when they come to a video like this is Give me the steps. Give me which exercise do I start with first, and then what's the next one after that, and which 3 to 5 exercises can I do to fix my knee arthritis? And it's not that simple. You're not going to find that just about anywhere. And in fact, if you do find a video that's like that, here's all the exercises to fix your knee arthritis, it's likely not going to work because it changes over time. I'll get into it so you guys can best understand that. So let me tell you the first key here. These are 3 keys. Let me just write that out here. 3 keys that, you know what's, let me give you a better title here. Can I have a tissue? Keys isn't the best word because I want to use the word principles. So sorry. 3 principles. Principles. Because principles are not, they don't change. They apply always. Just think of like gravity. Like on the surface of our planet, we have gravity. That's a principle. Everywhere you go, you will encounter gravity. You will fall to the surface of the earth if you're not already on it. And if you're standing on the surface of the earth, if you tip over, you're going to fall down. You have gravity everywhere you go. That's a principle. A principle that I follow in my method, in my secret method for knee arthritis, for number 1, is that knee arthritis, I'm just going to put arth, is a pressure problem. This is a big, big deal. Because what it's not, what I think that it's not, that the medical field thinks is that it's age-related. But it's not age-related. Big deal. And let me just explain this here, because if you're gonna follow my treatment approach, my method to healing knee arthritis, you have to understand this. You have to live and breathe it, and it goes against the grain, it's countercultural to the medical field. And you might hear other healthcare professionals out there preach this, say this is an age problem, and they leave you powerless because you're going to age no matter what. You're going to be older tomorrow and next month and next year and in the next decade if you can make it that long. And it puts you in a position where if it really is age related, then it's just going to get worse no matter what. Your knees are just going to feel more painful, more swollen, more stiff. But I refuse to believe that because I've seen it happen time and time again where people improve, avoid surgery completely. They don't ever have to have a knee replacement. And then they get back to doing very active stuff. I mean, we're talking hiking, walking, as long as they want, exercising. Some even get back to jogging if it's right for them. We have people asking us, is it okay if I can jog? Because I feel like I can. And we encourage them to. We tell them, if you fix all the right things, yeah, begin to ease into it. But fixing the right things means we're fixing the pressure problem. We're addressing the pressure, and we have to forget that it's an age problem. It's not. We have to stop believing it's an age problem. All right, so I'm going to list 4 little keys under this principle here. Number 2 is that if you have cartilage loss, this is a big deal because everyone that has arthritis, if it gets far enough, most people are going to see a doctor and get an x-ray. And so they'll say, if you have the x-ray, they'll show you the image of the x-ray. And let me just draw it out because it'll give you a better visual. So let's say this is a thigh bone, and here is a shin bone right here. And we'll just say that's your kneecap right there. If that's your x-ray, give or take, I'm not super artistic. What they'll look at is this space in the middle. Let me draw the space in blue. And really, there's a meniscus right there. So this is kind of like the meniscus. And when they look at your x-ray, the doctor looks for little things like thickening of the bone in this area, maybe a damage to the meniscus, a decreased space right here. And then when there's decreased space right there between the thigh bone and the shin bone, would you be able to unscrew the leg from the skeleton? I'll show you on the skeleton here in a second. But when there's decreased space right there on your x-ray, what the doctor assumes in that moment is that you have a loss of cartilage. But what you have to realize, follow me here, because this is completely understandable, An X-ray only shows bones. It does not show, an X-ray does not show soft tissues. Vaguely it does, but it doesn't show cartilage very well. It only shows the bones. And so when you look at this space right here where my finger is, there's a normal amount of space that you should have, assuming you have adequate cartilage and the joint is healthy and the pressures are normal on the joints. But if you have a loss of space right there, then the doctor assumes that you have a loss of cartilage. But what I'm looking at is that instead there's increased pressure in the joint, squashing the cartilage and giving the appearance of a loss of cartilage. And you might very well have cartilage there that's just being compressed. I mean, if you were to put your arm, or better yet, if you were to put your face on a piece of glass and smash it again against the glass, your face would not look like your face. It would look like it was smashed up against the glass. And when you take an X-ray image of a knee joint that's being over compressed, then it's not gonna look normal. It's gonna look like you have lost cartilage, but you might have cartilage there. So that's the second one here. I'm just gonna strike through this one here. You got to stop believing that you have a loss of cartilage. Oh, and I'll tell you why here. Here's why. Just want to make sure I'm following my notes correctly. If you had a real loss of cartilage, a legitimate loss of cartilage, you're likely going to have trouble bending your knee all the way and straightening your knee all the way, because the cartilage on the surface of the bone right here allows for that movement to happen well. And now you might have trouble bending your knee all the way to the end or straightening out all the way to the end. But if you have generally good motion, I'd say 80% of your normal motion or better, then chances are your knee joint is a functional knee joint. It works. It bends and straightens like it's supposed to. Even if you have apparent cartilage loss, if you have decent range of motion, then you probably can get away with healing naturally, fixing this pressure problem, and never having a surgery. But it depends on your knee motion, how much you can move. Now, there are cases, absolutely, where people get locking in the joint and the knee doesn't want to straighten out beyond this point, and it's uncomfortable and painful to fully straighten it out, or bending it all the way. And it doesn't want to bend fully all the way like this. It gets stuck and you have to kind of make your way through it, or it ratchets like a ratchet tool where it kind of sounds really gritty and grindy and it doesn't move very well. In those cases, that's when you can be way more certain that you truly do have cartilage loss or cartilage damage. And it may be beyond repair where it can heal itself, and it may necessitate, you may need at that point a joint replacement surgery. But those cases, I can tell you, being a physical therapist and having seen thousands and thousands of knee cases, they are the vast minority. By my estimation, as an expert in healing knee arthritis, less than 1 out of 10 people are in that category where they cannot bend their knee well, and I think that they need surgery. And I've been right consistently with that. I have people that I send towards the doctor and tell them you need a surgery, and they say, yep, doctor said we need to do this ASAP. And then when there's people that come to me and say, I don't know if I need surgery, and I look at their knee joint and it moves pretty well, even though it's swollen and painful and they can't walk very well, but the motion's there. I tell them what I just said to you. You have good motion. The mechanics are working. It's just swollen and painful. Let's do some stuff to get that under control, and then you'll be all right, and those people improve. So this whole cartilage loss, because everybody gets told that they have a loss of cartilage and that it's bone on bone and that you need a replacement. I think we're going too far with that, and we need to not be defined by the X-ray. And that's the next point here is don't be defined by your X-ray. It doesn't define you. Before I explain this, let me just tell you guys, our helpline is available now. There's the number right there. Call that number right now. So you can speak to our staff here and start getting in line to talk to me. I want to be able to answer your question and help you out. Especially knee arthritis questions, we'd love to take them right now since that's our topic. Going back to the X-ray label here. As soon as you guys are listening right now. Some of you guys have been told that you have bone-on-bone knee arthritis. As soon as an authoritative doctor has authority, right? They're an expert in bones and joints and osteoarthritis. When they wear their white coats, they have their degrees on the wall, and they have their nice office and everything, and so it looks like an authoritative, respectable place. And you know what? They probably are excellent at doing surgery and excellent at helping people in certain areas. But what you have to understand is that they are not excellent at helping people recover from knee arthritis without surgery, because their belief is not that it's a pressure problem. They think it's an age problem and that you have true cartilage loss. And so when they x-ray you and tell you you're bone on bone in your knee joint, you don't have any more cartilage, then they make comments like this. And I don't think that they intend to do it, in a way to hurt you. I think that they're really working from the information that they have, and they're doing the best they can with it. But they'll make comments like, you're lucky you can be walking right now. You have no cartilage. Or they'll say something like, you might last a year, maybe 2, or maybe they'll give you a little bit longer. This is going to be worn down really bad in 5 or 10 years, and you're going to need the knee replacement then. Call me up and we'll schedule you. They'll make comments like that. And you as a patient, because I see them all the time here in my clinic, they get to me and they say, yeah, the doctor said I have 2 years and that's it. And every step I take is just wearing it down further and further and further, and I'm losing more cartilage. And that's just not the case. That's not the way to look at it. So don't be defined by your x-ray. We have research, medical research for knees and for spines that shows that you can have a bad looking MRI. You can have so they've done it for meniscus. You can have meniscus tear, all kinds of osteophytes like bone spurs, and have no knee pain. That's a big deal, because it means that if your x-ray shows it's bone on bone, you're being squashed right here, really, but you do things to feel better, like maybe try this secret method I'm telling you about, I'm sharing with you here. It's possible that in a few months after you do everything properly, you could feel great, good enough for sure to not need surgery. But if you were to get an x-ray at that time, it might still not look fantastic. And the doctor might still say, well, you're a good candidate for surgery. I've had surgeries done on people with worse x-rays. But I tell people, I've helped people avoid surgery with worse x-rays. So don't be defined by the x-ray level, guys. It's not an age-related problem, and you probably can recover the space in the joint if you unsmash the joint so that you can have even better motion if you lost a little bit of motion. Okay, last piece here that is very important, and then we'll go on to the next principle. Weight loss is not always necessary. And let me give you the number here. BMI, which is body mass index, and there's a way to calculate it. I'm not going to calculate it right now, but if you can type in Google, or you can ask a healthcare professional to help you calculate your BMI. If your BMI is less than 35, sorry, let me redo that one. My handwriting isn't always beautiful. If your BMI is less than 35, then you tend to do well going through our method. In fact, it's a screening question that we ask people right before they join our program, because when you're joining our program, what we found is if your BMI is really high, past 35, then you're likely to need to focus on weight loss. Because when you lose weight, you do reduce the pressure through the knee joints. Remember, it's a pressure problem. However, we've seen thin people, very thin people that probably need to gain weight that have very severe knee arthritis, and it's not a weight problem with them. We've seen people that are good weight, normal weight, and they don't need to gain or lose weight, and they also can have severe knee arthritis. So what's going on there? We don't have a lot of medical research for that, but my answer to that, according to my method here, is that it's a pressure problem because of a muscle imbalance. More on that here in a second. So just focus on the BMI problem here. This is what I want you to think about. If you've been told that you need to lose weight, or you suspect that you have a weight problem, then check out your BMI. And usually what this factors in is if you have if you're overweight, 30, 40, 50 pounds, if you're somewhere in the 5'2" to 5'10" range, It's hard to give you an exact number because it depends on your height. If you're really tall, you can take on more weight and it's not going to affect your knee joint. If you're really short, then you can't take on as much weight before it starts to affect your knee joint. So that's why BMI is kind of a better number to think about. But the takeaway from this is it's not always weight. And I see too many people that are at a good weight. They're below 35 on the BMI scale, and they're really focused on their weight loss. And they're not focusing on taking the pressure off the knee joint by changing the way their muscles work. And as a result of that, they're wasting time and they don't see the improvements that they're hoping to get out of weight loss. Now, diet and weight loss are two separate things, in my opinion. They're related, but diet is more the quality of your food, whereas weight loss has to do more with the quantity of your food, how much food you're eating. Diet is what kinds of foods are you eating, because diet has to do with like inflammation. There's very processed foods might set up more inflammation in your body, which could worsen knee arthritis. So you have to consider that too. I'm not an expert in that though. I focus on the biomechanics, which is a very, very huge problem for everybody with knee arthritis. All right, so that being said, that covers principle number 1. I'll cover principle number 2 in just a moment, but let's get to the comments. Let's see what you guys are asking about here.
So you got 3 questions from this person.
Great, I got 3 comments we're gonna look at here from Mina. Mina says, hi, Dr. David, how to deal with the knee pain that happens after climbing stairs? Why does it happen? Is it ever possible to climb stairs in the future after chondromalacia grade 2? And then the next part is, what was your grade in chondromalacia, if I may ask, because I've shared that I've had chondromalacia patella. How long did it take for you to heal, and which activities did you avoid during your healing journey? Please guide. Thank you so much. And then she says, could you please guide on the pain in quad and patella tendon along with swelling in fat pad? Will glute exercises help in improving patellar tracking and help in the case of lateral patella shift? Great. All right. Can we go back to the first question? Thank you. How to deal with knee pain that happens when climbing stairs. Okay. First off, in chondromalacia patella, let me tie it to knee arthritis real quick because it's very connected. Chondromalacia patella is where you have a loss of cartilage or damage to the cartilage on the back of the kneecap right here. And it has to do with that same pressure problem that I'm talking about. In younger people, this is the beginnings of knee osteoarthritis. People that are in their 50s, 60s, and 70s that develop knee osteoarthritis often had chondromalacia patella when they were in their 20s, 30s, and 40s. And it's because of a muscle imbalance. And so when you are fixing the muscle imbalance, you have to usually not focus on quads, which is the muscles on the front of the thighs right here. They connect to the patella, the kneecap. Because if you have very strong quads and other muscles aren't doing their job, then the quads attach to the kneecap here, and it starts to yank on the kneecap and press it against the thigh bone, right where it lives. And then the tendon that runs down right here gets pulled. There's too much pressure going through it as well. And then right behind the tendon, right where my finger is where the fat pad is. You have a fat pad there that's necessary. It's not because of being overweight. You have fat pads around your joints in your body. It's part of the way the joint works, is to fill space and add cushion to tendons and things that are supposed to be on each other. And that fat pad can become irritated, and for the same reason, because there's too much compression going through the joint, and so it becomes irritated. It's just like if you were to scratch your skin, not hard enough to cut it, but to irritate it, you get red marks, you get redness, maybe you get bumps like where the scratches happened. That's irritation. It's what happens before damage comes on. And so if you have an irritated kneecap, chondromalacia patella, then you have a pressure problem that needs to improve. So let me just show you on the model here the way the tendons attach. So here's the quad tendon. All the muscles come right here. They attach to the kneecap. There's a better example of where the kneecap lives. And then you have the tendon right here. And then this space right here is where the fat pad is. All right, so to answer your question here, when you climb stairs, when you go bend your leg to step on the step above and then push the rest of your body up over, you are probably using your quad muscles on the front of your thigh too much. You probably have been naturally doing that because you're overcompensated. And so it hurts when you're going upstairs, and downstairs it can hurt too, because you're just using the quads too much. They're over dominant, and you need to begin to use your glutes more. You're already asking about that. You need to shift the imbalance to where you have better glute strength and you can consistently use your glutes going up or down stairs, and that should reduce the pressures at the knee joint and allow stair climbing to become painless, to feel fine. This goes for people with knee arthritis and chondromalacia patella. What's the next part here so I can answer that? Make sure I don't miss anything for Mina.
Is it possible to climb stairs in the future? And then it's this one.
Okay. So you can definitely climb stairs in the future. I had trouble with stairs. So just my chondromalacia pain story is that I've always been very active. I've always been into running. When I was in undergraduate, when I was getting my bachelor's degree, I was in the best shape of my life. I specialized in becoming a personal trainer. I was a personal trainer for a while. And during my time as a trainer, I was exercising all the time. In gaps within my schedule between clients, I'd go lift weights. I didn't have a concept of this muscle imbalance idea, so I would just lift weights so that I could look good, so I can have muscles, wherever I wanted to build them. And I would run a lot too. I was very into running. I was winning 5K races. Like I signed up for the local 5K race to try to get the first place trophy, and I often would. But because of that, I was younger. I was in my early 20s. I just finished my bachelor's, and I was about to start physical therapy school. First year of physical therapy school, I had to sit all day long because that's how it is. And then I'd go home, eat dinner, and then sit for another 3, 4, 5 hours to study for the next day. So I was sitting for 18 hours a day. That was my entire first year. It's a 3-year program. Finally, once I got to the rough first year of physical therapy school, I had a little more free time in my schedule, and I thought I should go running like I used to at the same speed, and that was not very smart of me. I flared up my knees so bad. I was so quad dominant. I had been sitting, which made me not use my glutes, so I became very dominant on my quads, and that's what flared up my chondromalacia patella. I had to go to the doctor. I started to have foot problems too. It was a series of issues, and I can go more in depth at another time. But the way that I fixed it is I focused on using my glutes all the time. This is when I began to discover, I was in the middle of physical therapy school going into some advanced training, but I began to discover that if I turned on my glutes, I shut off my quads and my knee pain would not hurt. My knee pain went away. And then I started to apply this to patients with knee problems, and it worked for them. And then I started looking at the body completely different in light of muscle imbalances, and that's how I discovered it. And then I started to move it into other activities like stair climbing and walking and cycling, and it was very much influenced by things I was learning too, and while going through my education. So hopefully that helps you, Mina. That's just how my background. Today I'm about to be 40. I'm a week away from my birthday, and I run 3 to 5 miles at a time, at least 2 times a week, if not 3 times a week. I deadlifted yesterday. I did 100 reps, over 100 reps. I think I did 120. So I think I did 6 sets of 20, plus sit-ups, calf raises, other exercises. I think I work out almost as much now in my late 30s as I was in my early 20s. And that's, having dealt with knee problems. So hopefully that helps you out. Good questions in the comments here. All right, so we got Susan next. She says, I keep getting pseudo knee locking. It's extremely painful. What can I do, please? So knee locking happens when there's a lot of pressure going through the joint and the cartilage inside might be damaged. Maybe not permanently, maybe permanently, but either way, there's rough surfaces, because the whole point of cartilage is it should be smooth on one end of the bone and smooth on the other side of the bone, so that low friction movement can happen. Because if without cartilage, then you have bones that are rubbing on each other and there's friction generated that causes pain. But with cartilage, it's nice and smooth. If that cartilage gets damaged and you have a divot, a dent in it, or a crack in it, or a tear in the cartilage, now you have an increase in friction, and it can catch. It can grab on itself and lock your knee joint. So what you need to do, Susan, is it Susan or Sue? Yeah, Susan. You need to reduce the pressure in the joint. You have too much pressure that's smashing those surfaces, the cartilage surfaces against each other. And if you were to take that pressure off, even if you have a tear, even if you have an uneven surface of cartilage there, you increase the chances that you'll have better freedom of movement within your knee joints, but you have to start there. And if you can at least do that, even if your cartilage damage is so bad that you do need to have a procedure done for some reason, you're setting yourself up for not having to have more procedures done in the future and being able to have better knee health. This is a big deal because I have a lot of people that say, well, I'm just going to go get the surgery. Doctor said I have a good doctor. And I get it. Like, you might need the surgery, but if you don't go through this process of fixing the pressure problem, correcting the muscle imbalance, where are you going to be at next year or in 2 or 3 years? You're going to wind up with the same problem. It might present slightly differently. It might be in your kneecap more than in the knee joint, or you might develop a hip problem because this problem can affect joints above and below. It could affect your foot. But it's the same root problem. And the thing is, doctors won't tell you that. They'll say, oh, well, that was a meniscus problem you had last time. Now you have a patella problem. It's different. It's the same root problem. That's why this method's so effective, because it takes care of everything, because we're looking at the body differently. It's not age or your cartilage loss or any of this stuff. It's not, as long as your weight's not too high, you don't need to focus on the weight loss. And this is a big deal because a lot of you guys you're stuck in a cycle of, I need to lose weight so I can exercise, but when I exercise, I hurt more, and so I don't exercise as a result, and I'm gaining weight. But this gives you a better framework to better deal with this. So anyways, hopefully that helps you, Susan. Kimberly says, after my broken hip and total knee replacement on the same leg, it is now 1 inch longer. That happens. My IT band been working hard on strengthening muscles, especially the glutes. Any suggestions? It sounds like you're on the right track, Kimberly. So just to give everybody else some context here on what Kimberly's talking about. So she had a knee replacement. That's what TKR is. And then a broken hip. So usually the bone right here breaks and surgery might need to happen to fix it. But that leaves you weak because you were probably off your feet for a little while, or you weren't doing very much after the knee replacement and after the breakup here. And if your glutes were already weak, they probably got even weaker. And your quads might have been dominant. They probably were. They got even more dominant in the recovery after the knee replacement and the broken hip. So you've got to make sure that you wake up those glutes and get them stronger. And Kimberly, because you had 2 situations that are going against you here that are, not helping you out, you might just have a longer road of glute strengthening to go through than somebody who didn't have a knee replacement or a hip break. And it's often longer than you think. And a lot of people, they're doing bridges or doing glute activation exercises, glute sets, or they're doing lunges and mini squats. And my encouragement to you is keep going. Keep going. An analogy that I use often, Kimberly, is I homeschool my kids, and we have elementary age kids, some of them. We have some middle school, one middle school, another one that's about to be middle school. And if you think about it, like you guys all probably went to school at some point and you learned how to read. We're in the middle of teaching my kids how to read. And if you think about it, learning to read takes years. Years. You think I learned in first grade, but really you learned how to put a few letters together in first grade to form a word: cat, ball, whatever it is. Then as you progress through second grade and third grade and so forth, you begin to put sentences together. You go over your vocabulary. You begin to put paragraphs together. You read books that have chapters. You read very big words. By the time you're in 5th grade, hopefully, you're reading excellently. But it took you 5 years to get there. Kimberly, it's the same thing with glute strengthening. You have not had good glute strengthening, good glute strength for a long time, and have been dominant in your quads. And you're starting from first grade, and you've got to work your way up to 5th grade to where you have awesome glute strength. It's helping you climb stairs. It's not affecting your hip or your knee anymore. It just takes a long time. You can't do it in a few months. It often takes the better part of a year, if not years. So keep going. Good comment here. Oh, one thing to mention about the leg length being longer, that happens from surgery sometimes, and it's hard for the surgeon to control. So, talk to your surgeon and see what could be done, but you might need to put a lift in your shoe. You can try that, see if that helps you out, but it doesn't always work. Some people say they prefer without it. because of the way that it makes them feel. Plus, and I encourage them to be able to not rely on the lift in the shoe, because then what if you want to walk around barefoot? You have to at some point, right? You have to take a shower. You might want to enjoy a walk on the beach or something, and you need to be able to tolerate barefoot walking at some point. So it's worth it to just have so much strength that the leg length difference is irrelevant to you. You can compensate for it because your glutes are solid. All right, next comment here. Wendy Dandridge in Sonoma County, California says, in B to knee arthritis, I'm anxious. Okay, we're gonna go to the next one. Oh, I'm new to knee arthritis, hoping to prevent worsening and manage my current status. Well, welcome, Wendy. I hope that we can be of service to you and help you out. Hopefully this video is of help to you. Number one thing we're going to start with when I get to the third principle is going to be how to manage the pain, how to keep it from getting worse. And then after that, how to prevent the problem from coming back. So stay tuned. We're going to cover more here. All right, let's get on to number 2 here. Let me just erase this all here. Thank you guys for those comments. That was awesome. Keep them coming. We'll get to them as best as we can. And don't forget, we have the helpline if you haven't tried calling yet. If you're calling and you're not getting through, we only have one person on the phone right now, so I'm so sorry, but we'll expand those opportunities more as time goes on. We're trying this out right now. All right, principle number 2 here. Make sure I don't miss my notes. Oh, we have a call. Let's go there first. Sharon, can you show me that one more time? We're going to speak to Sharon here next. And she's in Maryland and has hip pain, back pain, and sciatica pain. She's coming on board. This is a good one because it's very related to knee arthritis. Coming over here. Let me just make sure I have this on right. Sharon, are you with me?
I am, Dr. Dave. How are you?
Hi, Sharon. I'm doing well. Nice to meet you.
Nice to meet you as well. I'm so happy I get the opportunity to actually speak with you. I found you on YouTube maybe 2 or 3 months ago. So I've been trying to do some of your exercises, but I think my case might be a little different for you.
Okay, well, let's see how I can help you out.
Okay, and I'm trying to expedite it so everybody else can ask because I know they got questions.
Well, I appreciate it.
So 58, you're welcome. 58-year-old, menopausal,
okay.
Diagnosed with osteoarthritis in the hip.
Okay.
9 months post-op total hip replacement in the right hip. Left hip still has the osteoarthritis, but I've been trying to do the exercises.
Okay.
I am 6'4".
Okay.
6'4", literally 6'4".
Yeah, you're taller than me.
The tears and all that stuff, nothing fits me. But then I got the L1 through the L5, the herniated, the bulging, all that other stuff, right?
Yeah.
So I got the hip, I got the back. But my primary question is, where do I start first with the treatment? Because you always say everything is connected. So I don't want to isolate the hip and I'm not getting the back. So do I do a version of everything like combined? Or like, what do I do with that? That's my question.
Great question. So if you have a back problem and a hip problem and maybe even a knee problem for other people listening out there who are dealing with that, I would start with working on your abs first. I would start in the middle of your body because if you can get your abs stronger, then it sets you up to get stronger glutes. And then you can work on the feet after that because those are the big 3 muscle groups that often need to be worked on. It's the lower abs specifically, the glutes, and then the toe curl muscles in the feet, the ones that help you to curl your toes. Now, because you're tall, this is I don't talk about this much, but I like that we're having this conversation. Tall people tend to have longer torsos. Not always, but is this the case for you? Are you more spine than legs? Would you say that's the case, or are you?
I'm actually more legs than spine. I have a daughter who's 6'5". Dad was 6'11", with a first-round draft pick for the Knicks.
Oh my gosh!
We can't avoid it. Yeah.
Gotcha.
He had already like 3 or 4 knee surgery,
Okay.
but he's retired now and all that stuff. But I'm not trying to be like that. And I'm trying to get the help from you, Dr. Dave, the expert, because my daughter, now I'm 6'4", but I only weigh 215. And technically that's not big for my height.
Yeah. That's
I'm actually
spot on
for women.
Yeah.
So I'm not like overloaded there now.
Yeah.
I ain't been doing a whole bunch of exercises. You know, when you get old, Dr. Dave, you're like, So that's where I am.
Well, here's my advice. Because you're more legs, what I was going to say, tall people, not always, but they tend to be more torso than legs. In that case, it's even more important to strengthen your lower abs because the abs help control the spine. But if you're more legs, then glutes might be slightly more important. Either way, in your case, because you're suffering with a back problem, I would focus on the abs. That's going to set you up to work on the glutes. Both are important at the end of the day, Sharon. You got to work both the abs and the glutes. And truth be told, as you're going through the treatments, as you're going through the exercises, you're kind of going to work both at the same time. They're going to overlap a lot. But if you had to give it a percentage, if you had to say, well, this week, what's the percentage split on abs versus glute exercises? I would shift it more towards abs. I'd say like 70% abs, 30% glutes. And then as you improve on your back, as you feel your back improving, then I would shift that percentage the other way. Do 70% glutes and then 30% abs. I would never leave the abs behind, though. I would make sure that they're always working for you so that your back problem doesn't start to stop you when you're focusing more on your hip problem.
Well, I appreciate that. If you don't mind, I want to share a quick tip with your viewers that I learned from you after the fact, Dr. Dave.
Okay.
I was doing the glute squeezes. I thought I was doing something. You said get obsessed with them. Every time I was watching this, I work remote. I'm squeezing. And then I went and got the massage gun that you suggested.
Yeah.
Well, I didn't know. I'm massaging all over. I'm just to go away. The next day, the sciatica came. I said, oh, my God. But then realized that the pulsation from the massage gun had triggered it. And then I went and saw the very next morning, because I watch you so much, you just automatically pop up on YouTube.
Oh.
And I can't cuss on the phone I want, but you can imagine what I said after I saw that. I said, God dang it, I am pissed. So right now, I'm recovering from that. And one of the other biggest things for me is the chairs and stuff never fit me the way they're supposed to. I never get the support on the knees. You never get the support on the back. So, you know, even trying to sit straight up is kind of like an issue. But I've got to say, and I hope every viewer you got is listening to me, you are the best. I live in the state of Maryland. I just wish I would have found you earlier, but it's not too late. And I've been doing the pelvic tilts and then touching my pelvic bones and squeezing for 10. So I'm working on it. So
that's
I'm
fantastic,
slowly doing the get on the bed on all fours and, you know, move back, because this just happened within the last 48 hours with the sciatica. So I'm really like hesitant. But I said, I got to get back to doing this, because it was wonderful before I got that gun and got all happy and started massaging all over my body.
Yep. Be careful. Be careful that you got to stay off the nerves. But it's not always easy to know exactly where those nerves are, you know, unless you're medically trained. So you found out the hard way, unfortunately, Sharon, but at least you're doing the right things to be able to get out of the sciatica flare up and then to strengthen the right muscles to fix the back and the hip problem. So you're on the right track. Great job.
Well, thank you for even taking your time out to come on YouTube and help so many of us. A lot of people don't have insurance, or they do, or whatever the case may be, or they can't get out the home. I just honor you, and I appreciate you for actually truly caring about human beings.
Of course.
It's just terrific, honestly.
I'm happy to do it. Happy to do it. I'm glad that you're willing to do this stuff, because it's, you know, it's not your mainstream medical advice. And so I praise you for trying it out and getting some improvements. So keep going, Sharon. You got this. No surgery.
And I'm going to keep watching. Yes. Thank you so much. I appreciate it. Thank your staff for putting me on.
I absolutely will.
Day.
You too, Sharon.
Okay.
Bye-bye.
All righty. Bye-bye.
So neat. She's such a sweetheart. I love that. So just to explain a bit about what Sharon was talking about, the massage gun, the one that vibrates. I don't think we have it. Oh, yeah, we do. Great. So here's a massage gun, and you might not be able to see it because of the way the camera works with this, but you've probably seen these at some point. The tip of the massage gun here is is moving back and forth very fast, and that helps to relax muscles. However, if you put that on a nerve, like the sciatic nerve, it can irritate the nerve. Nerves really don't like two things. They don't like vibration and then excessive stretching. And if a nerve's irritated already, like on the verge of irritation, or it's already irritated, if you add vibration to it like this, or you start to stretch it, it's going to become more irritated. However, when nerves get irritated, especially like the sciatic nerve, which is in the back of the thigh, it can make the muscles around the nerve start to tense up, which makes you feel like you need to loosen it up with one of these. And so that's kind of the tricky part of using a massage gun, is if you're dealing with irritated nerves, you got to be very careful to not be on the nerve when you're this, stick to the muscle. And sometimes it's a little bit of trial and error to figure that out. But the other part, just to break down Susan's call, is if you have a back problem, a hip problem, and a knee problem, they tend to all be related to the same muscle imbalance concept that I'm going to get more into. But I would focus on the abs first, your core muscles, and then work on glutes and feet after that. You can bias my method to apply to where your weakest spots are first. But I would still encourage you to work on all of them because you're going to benefit from that the most. Good question, Sharon. Love talking to you on the phone, Sharon. All right, let's talk through the next one here. Let's talk about the muscle imbalance. So the second principle number 2, in order to fix knee arthritis, improve it, and get it to improve for the long term, is you have to have immense focus on correcting the muscle imbalance. Write it down here. And a muscle imbalance, that whole concept it's kind of vague in the medical field, and I try to make it as simple and straightforward as possible. I'm going to explain it to you in just a second, but you'll hear other healthcare professionals out there mention muscle imbalance. I've talked to many people about this, colleagues, and they don't describe it exactly. Like, what is it? What is a muscle imbalance? They say it as a vague term. Like, well, the best example I can give you is I have had patients in the past who have had joint replacements. They had their knee replaced or their hip replaced, and they continue to have pain after the joint replacement. Then they go to the doctor, the surgeon that did the joint replacement, hoping for some answer. Why does my knee still hurt even though I had the replacement? I still can't put weight on it. It still swells. Something's wrong. Then the doctor, as they should, will take the x-ray, and then they show the x-ray to the patient, and they'll tell the patient this: the surgery looks fine. All the parts that I put in there are just where they should be. Nothing came loose. Everything's perfect. And then they'll say something to the effect of, I don't know what's going on with your knee. Surgery's okay. There's nothing I can do at this point. Must be a muscle imbalance or some muscle issue, some nerve issue, some other problem that I can't help you with. And it sucks to hear that, because then where do you go next? The surgeon's pretty much washing their hands clean and saying, I did what I could, and I'm sorry it didn't work. And that's what they should do at that point. But where does that leave you? You're essentially powerless. And them just saying, well, it's a muscle imbalance, go try to work with a body worker or something. I've heard them say that doesn't give you much guidance. But I've defined it as best as I can for you, and I'm going to draw it here so that you can understand this muscle imbalance. I need a little bit more space. I'm just going to erase this here, and let's draw. Can you guys see it if I draw right here? Okay. Let's draw a thigh bone. So let's start with the ball. And then there's the bone. It ends down here. Here's the kneecap. Here's the shin bone. I'm not good at drawing bones, as you can see. And then we'll just say this is the foot down here. There's a lot more bones than that. But here's what I want to describe to you. On the front of the thigh, you have the muscles called the quads. On the back of the thigh, you have some other muscles called the hamstrings. And then I'm not good at drawing this bone either, but let me do my best. you have the pelvis bones that are kind of shaped like that. And on the back of the pelvis, you have glutes. These are your butt muscles. When glutes are weak, when they don't work very well because they're weak, they don't turn on, they don't activate when they should, quad muscles become strong. They become dominant. They take over. They compensate. They can act when the glutes won't. As a result, they get all the reps when you go walking, when you stand up and sit down, when you are doing chores around the house, when you go to the gym and try to exercise. You're using your quads way too much, and hamstrings can also participate in this imbalance. But I focus mostly on the quads to the glutes imbalance. And this concept right here, the muscle imbalance, this gives you power. You know, I mentioned that you're powerless often because when you go to the doctor and you get diagnosed with arthritis for the first time, they'll do the x-ray like I drew earlier, and they'll say, here's your knee. And based on your x-ray, you have, osteophytes and irritation and loss of joint space. They'll tell you all the problems. And then they'll say something like this: according to your x-ray, you have stage 3 osteoarthritis, which means you're good to go for surgery. You should have a knee replacement. They call it a TKR, a total knee replacement. There's other kinds of knee replacements, but that's the most commonly done one. And so they're looking at this, and the staging, they go from stage 0, which means a normal knee, you're fine, no problem. Stage 1 is the beginnings of knee arthritis, like there's a little spot of a problem. Stage 2, where it's more moderate. 3 would be more severe, and then 4 is end stage, where you absolutely have to have surgery. This is the type where you get ratcheting, the joint doesn't work right, it's constantly swollen and painful. This is an absolute yes, let's go have the joint replaced. Anywhere here, 1, 2, and 3, you could probably get away with fixing muscle imbalances to get the problem better. The thing is, the doctor, the surgeon, they're trained on this system. It's called the Kellgren-Lawrence system. And what their belief is that once you hit a higher stage, you can't go back. You're just going to progress because you age into this problem. It's an age-related problem is what they say, which I disagree with. And so if we forget this thinking for a minute, I'm just going to draw a big X through it and focus on this instead, on correcting the muscle imbalance, on getting stronger glutes and not necessarily weaker quads. What I would rather you do is something like this. Let me erase this. Think of it like a graph. If you have knee arthritis right now, and we said your glute strength versus your quad strength, your quads are a 10 and your glutes are a 1. This is what's going to increase the pressure right here in the knee joint, behind the kneecap. That's what's going to cause the locking, what's going to shred your meniscus. But if we can instead move to making it, this is glutes and this is quads, a 10 and a 10, make it balanced relatively. What this does over here is it sets your quads to act when they're supposed to, because your glutes act when they're supposed to. But in this setup over here, your quads just do all the work and your glutes never show up. They don't show up adequately enough. When you need to go up and down stairs, you don't have the glute strength to do it, so you use your quads, and that increases the pressure of your knee joint. But if you have better glute strength, now you can turn on your glutes when you need to while going up and down stairs. And your quads act only when they're supposed to. They're not having to act extra because they don't have glute strength. So you need to get that weakness up right here and not necessarily get weaker in the quads, but it's a balance of strength that needs to happen. This focus on correcting the muscle imbalance is a secret that is not shared in the medical field. I'm the one that's constantly telling people about this. I don't know very many other healthcare professionals, except the ones that I've trained, that talk to their patients like this and have this idea to impart on them. It's not age. It's not loss of cartilage. You're not defined by your x-ray. and you can do something about it. Most healthcare professionals out there that are telling people to exercise, they're having them do quad exercises. But if your quads are already a 10 and your glutes are a 1, why are we strengthening the quads? You're going to end up with a 15 or a 20 here and just increase the pressure even more down here in the knee. It's no wonder why you're going to go from a 0 on that Kellgren-Lawrence scale, the stage 1, stage 2, all the way to a 4. And doctors are thinking exercise isn't going to fix the problem. It's just going to delay surgery. Because that's what they typically see. They see people with beginning stages of knee arthritis and they just get worse and they send them to physical therapy. But most physical therapists out there are helping people after surgery. That's what they're great at. Physical therapists are excellent at helping you recover from surgery, but not avoiding surgery. That's what I'm about here. That's what all this information is for. All right, so you've got to get stronger glutes to allow the quads to work normally. And then there's some foot stuff that I talk about, but that is principle number 2 here. Focus on correcting the muscle imbalance. And as Sharon was saying on the call a moment ago, is you need to get obsessed. This is a big deal because when going through an exercise program, especially one led by like a physical therapist, you might only exercise a few times a week. We have this idea that you just need to exercise a few times a week in order to maintain your health, your muscle health, your joint health, whatever it is. But if your glute strength is here, it's a 1 and your quad strength a 10, and you're in a lot of pain and you want to improve immediately, you need to get that glute strength up as fast as possible, which means you need to focus on getting the glute stronger. You need to obsess on more glute strength, which means I tell people to do stuff hourly. As long as you can tolerate it and it's not making things worse, you can fit it into your schedule. You should be tiring your glutes out hourly in order to get this better balance as fast as possible. It takes effort, it takes work. Which, by the way, guys, I've got stories of people that I've done this with here on our YouTube channel. I've got a case study specifically. I've got it here somewhere. Here it is. I put into pen and paper, computer screen, Mary's knee arthritis recovery story. And in this case study, I have written all the details of every treatment that I did with her. By date, it's all in there. And you can see exactly what I did and how I've implemented this stuff with her. If you want to download this, you can. Go check out the link in the description and just go to the website here. Do we have the website up here? You can go to the website or the link in the description, and you'll see where you can download Mary's case study on how we helped her with her knee arthritis. And she was told she needed surgery. She couldn't walk very far, forget stairs. She was having trouble sleeping at night. Her knee was swollen. She went to physical therapy and it got worse. They were having her do things that weren't promoting the muscle imbalance. It was a physical therapist that was great at helping people after surgery. So they just didn't know how to handle her. But when she got to working with us, we fixed all the muscle imbalance stuff. It didn't take her that long either. She was very, very much improved within 2 to 3 months. I have it all here. We did 12 sessions with her. So go check out the case study if you want to just learn more about this. So that you can see what we did with Mary. And on that website too, by the way, you'll find a quiz you can take because, I mentioned earlier that Kellgren-Lawrence scale, but let me just start erasing this. There's in our knee arthritis recovery program, we have, I don't like the stages concept, the Kellgren-Lawrence scale, because it implies that you can't get better. And that doesn't sit well with me because I see so many people get better with knee arthritis once we start doing the right things. But what I would rather frame it as phases. And that's what I'm going to talk to you about for the third one. And knowing what phase you're in is super important. And so I'll tell you about the phases all here in a second. But I just want to let you know before I forget that if you want help with figuring out what phase of knee arthritis recovery you're in, the phases that I've developed for my knee arthritis recovery program, you don't have to be in our program to figure out what phase you're in. I've made a quiz that you can take on our website. Can we show the website? There it is right there. You can go to the website and poke around on our website. You'll find the quiz for our knee arthritis recovery program, and you can learn what phase you're in. And then once not only will you learn what phase you're in, but you'll also be able to download a report for your phase. So this is the phase 1. You see the 1 is highlighted right there, report. And in there's a bunch of details about what you should do and what you shouldn't do. Just advice on going the right direction, what you should be feeling. It's super helpful information. We've got a lot of good feedback on our report. We've put a lot of effort into making it look pretty and all that stuff. So if you want to take the quiz and get the report, you can go into the website. But let me tell you about these phases, because this is going to be so helpful for you. When you figure out what phase you're in, then you should only focus, on treatments from the phase, from your phase. I have 4 phases. Let me show them to you right here. So the knee arthritis recovery program. So phase 1 is when you're in severe pain. It's hurting most days of the week, if not all week. Pain at night, you have swelling. You can't be on your feet for very long, not more than 10 minutes. And then your glutes are not active. You can't even use your glutes. And then in phase 2, it's less painful, better glute activation, hopefully. In phase 3, it's even less painful, hardly hurts actually. And in phase 4, you're doing fantastic. Depending on what phase you're on, according to these criteria, you should be doing certain things here. And even though there's exercises over here in phase 2, 3, and 4, you should not touch those exercises until you're in the clear. You're completely out of phase 1 and you're in phase 2. If you try to do things from phase 4 and you're in a lower phase, you're going to make yourself worse. This is why there's no one exercise that fixes knee arthritis, because we could say that squats help knee arthritis. And that's true if you're here in phase 2 or in 3 or 4, but definitely not if you're in phase 1. And it's a maybe if you're in phase 2, because we start introducing it here. And if you're not ready for squats, you shouldn't be doing them yet until you go through all the right things in phase 2. And there's different types of squats. So there's just a lot of gray area that you have to navigate through when fixing knee arthritis, and this clears it up for you. But the principle here that I want you to follow is you need to know your phase, know what phase you're in. So that's why you should take the quiz and get the report so that you can better understand. I tell you what exercises to do in here according to the phase that you're in. Then you can focus on just doing those treatments / exercises. I'll just write it in parentheses, because as you get better, it's mainly exercise you need to do. But in the earlier phases, you might need to be using a massage gun like I have here, or you might need to be using ice or heat. There's other things to do besides exercises, depending on the phase that you're in. Guys, just want to remind you that the helpline is open. Do we have the phone number? We're taking calls. We're hoping to get another call or two before we're done with today's live stream. There's the phone number right here. Call us up. I want to hear from somebody. I want to be able to help somebody like we were helping Sharon earlier. All right, so back to this. Let me draw you a picture of what it looks like to only focus on your phase. Why you should focus on your phase. It is a stair-step process. So if you're in phase 1, this is where we're focusing on reducing pain and getting control of the situation. I'll just leave it like that. We're trying to get the pain under control. If you're very swollen in your knee, it's like that most days of the week. If you can't sleep at night because the pain's waking you up, if you can't tolerate walking for very long, I mean, literally you walk through a part of a store and you're already wanting to find a place to sit down because your knee is so bad, you're in phase 1 and there's certain things to be doing there. If you're in phase 2, it's not going to fit here. I'll just have to, let me redraw it here. Just going to draw all the boxes now so that I can make it fit. So phase 1 decrease pain. Phase 2, we're activating muscles. As I was saying with the key muscle groups, glutes being one of the biggest ones, we have people that join our programs and they have never been able to fire their glutes. I mean, they can't even turn them on. And the concept I want to share with you right now, wherever you're at, if you think to tighten your glute muscles, whether you're standing like I am, or you sit down, or you're lying down, if you tighten your glute muscles as hard as you can, hold it there and think about what muscles are actually working. And the longer you hold, you should feel your muscles begin to fatigue. And if you feel your thigh muscles fatiguing before your glutes, that is a very bad sign. That means your glutes aren't activating the way they should be, and you absolutely have a muscle imbalance. That's why it's part of the criteria here. In phase 1, in all the phases, glutes is a factor, but in phase 1, the criteria is you cannot flex or tighten your glute muscles. Other muscles flex instead. Because think about it. If you go to do a glute exercise and you can't fire the muscle, you're not working your glutes out. You're working out your thighs. You're in an imbalance. And you're actually feeding into the problem because those thigh muscles are now going to compress your knee joints. You're trying to work out the glutes up here. Here's the hip. Glutes would be in the back. And your quad muscles are here on the front of your thigh. And you try to tighten your glutes, but nothing happens up here. And quads just, they're used to working. They yank your kneecap up into your thigh bone. And then because they have that connection that you can see here better, the quads are pulling up right here, so it pulls the kneecap up, and then it yanks on this tendon. You might get tendonitis, you might get bursitis, the fat pad could get irritated, but because this tendon here connects to the bone below, it pulls the shin bone up into the thigh bone and smashes your meniscus and everything in between, because your quads are so dominant and your glutes are not even active. So here in phase 2, we have to activate the glutes, just get them to turn on. And it might mean that you have to go really, really, really slow. That's okay, as long as you get it to happen. This is why, by the way, so many healthcare professionals out there unsuccessfully help people avoid surgery. And they give up because they're not even aware of this whole activation of the right muscles. They just think that if you activate everything, that you should improve. But they're inadvertently leading people towards further activating their already very active quad muscles and further compressing their knee joint and perpetuating or making knee arthritis worse. They increase the pressure in the knee joints and it just worsens the whole situation. It speeds up knee arthritis. Then people end up with more knee pain. And very often I've seen physical therapists do it where they say, I guess this isn't for you. Let me send you back to your surgeon because physical therapy didn't work for you. But really they were having you work your quads the whole time. They didn't know that they were actually harming you. All right, so that's phase 2. Let's get phase 3 here. In phase 3, we need carryover. And what I mean by this is once you can activate your glutes and other muscles, your abs and your feet, you need to do it all the time. It needs to be the way that you move always. So if you think about walking, for instance, because you probably walk everywhere, you desire to walk more. If you're walking to the store to get some groceries or to pick up something from the store that you need, you should be firing your glutes as you do it. In fact, you should feel your glutes get most tired, most fatigued, the longer you walk. If it's actually your quads, then you've got a problem. You're in an imbalance and you need to rethink the way that you're walking. I talk about this in the program. We start to figure out walking here in phase 2. And then same thing with stairs. You might be overusing your quads in stairs. And here in phase 3, you're quad dominant going into stairs. There's right ways to use stairs. There's, tricks, there's things you should be doing. But at the heart of it all, you need proper strength in your glutes to go up and down stairs. And if you're quad dominant, it's going to hurt you most of the time when you go up and down stairs. So you have to finish this here. You have to get better carryover from the right muscles in phase 2 into phase 3. So this is where you need to be practicing all your daily activities. Now, phase 4, we need to strengthen. You need to become The person that now weight lifts, does regular exercise, and I'm not talking about super heavy weights, but something to maintain the strength and build the strength in those weak muscles enough so that you have a buffer in case you get sick, in case you have a spill, you have an injury, something happens to you that you cannot exercise and maintain your strength and it goes down, so you're not back in phase one and in pain again. Because many of you guys out there don't have very much strength in the glutes, in the foot muscles, in the abs. And if you like Kimberly was saying, you have to go through a knee replacement, or you have a break in your hip, or you come down with some major illness and you just can't do much, you're going to lose strength very, very fast. So you need a buffer of strength that takes you time to earn, and you need to maintain at a higher level of strength than where you were at the beginning in those key muscles, the glutes, the feet, and the abs, the lower abs, so that you're not falling back into it. That if you go through these steps, you stair climb through this, then you will get to the point where you feel confident in your knee and you don't feel like you need surgery anymore, and you can go do more ambitious activities like hiking, exercising, potentially even jogging. This is how you stair step your way through it. This is the secret method. This is how you improve. So it's those three principles, guys. Let me get to the comments here next, and then we'll summarize everything. All right, let's come over here. Let me get a swig of water. Who's here with us? I'm showing 131 viewers with us across Facebook and YouTube, and we're also on Instagram. Linda's here. Linda says she's scheduled for a knee replacement. After following you and listening for a while, I am thinking I am not ready. What number do I call to speak to someone? Thank you for your dedication. Call the number that we have on the helpline. Ever since we started the helpline, there's the helpline right there. We've had people call when we're not on and leave a voicemail, and we'll get back to you. We've been trying to call back everybody that we can, just to make sure that we don't leave you guys hanging. I genuinely care about everyone. I want everybody to get the help that they need. So if it's right for you to work with us, then we need to have that conversation. Mighty Blues 7 says, here's a question that I never hear. I kept getting Baker's cyst, very painful, which causes blood clots. Why is this happening to me? I'm so sorry you're getting Baker's cyst. So just so that we're all on the same page about a Baker's cyst, I'll use this one. Here's a knee joint. So you have the kneecap right here in the front, and you have more stuff on the front of your knee than you do on the back of your knee. On the back of your knee, there's the joint capsule, which is ligaments that are holding in the joint fluid. It makes it like a capsule. It encapsulates the fluid. And then you have some nerves and blood vessels. But because there isn't a kneecap on the back of your knee like there is in the front and this big tendon, when you are putting too much pressure through the knee joints because of this muscle imbalance that I'm telling you about, sometimes the body will produce extra fluid inside the knee joint to try to protect and cushion everything in there. The fluid also helps to nourish the cartilage and the meniscus, all the things that are inside the knee joint. And so it's your body's effort to try to heal and protect the knee. You have to take the pressure off long term to get that fluid under control. But if you don't have good control of that fluid, then you start to build more of it. And because it doesn't have much space to go anywhere, the back of the knee is the weakest point in the knee joint where that fluid can pooch out and pocket. And they call that a Baker's cyst. And that Baker's cyst can definitely pop or rupture is what they call it. And the fluid can trickle down. And I don't know about it causing a clot. There's potential for that. But that's also, a very bad thing, because that can go up into your lungs, into your heart, and cause some serious problems. So the thing to focus on here for you, Mighty Blues, is you have to get this muscle imbalance under control. You have to decrease the pressure going through your knee joint so that the fluid isn't building up too much. A Baker's cyst is highly connected to knee arthritis. If you have a Baker's cyst and have not been diagnosed with knee arthritis, you're probably on the verge of having knee arthritis if you don't already have it. It's your knee joint screaming at you, I'm trying to fix this. It's your knee joint crying, if you will. It's creating all this fluid. It's trapped inside the knee joint, and it's trying to get out. So stop making your knee cry. Let's fix the imbalance. James David Klein says, thank you, Dr. David. You saved our knees. We're 76 and 79. So grateful. You're welcome, James. I'm glad that you did your work, because I can't make you do exercises. I can't make you watch the videos and learn. It's very much learning on your part. So kudos to you. Congratulations to you. I assume your partner. And I hope you guys have tremendous knee health the rest of your lives and can do everything you want to do and enjoy life to the fullest right now. We have Valerie next. Valerie Beecher. Hi from France. You are the best. Oh, thank you, Valerie. I appreciate it. Wave to you as well.
Julie has 3 questions.
All right, we got a 3-part comment here. Julie Parker's back. I would love to be able to go bushwalking again. My left knee doesn't bend all the way. Oh, sorry, Julie. Can I get my ability to bend my knee back? That's a tough one, Julie. Yeah, and you're going to need, hiking, bushwalking. You're going to have to potentially climb up rocks or, terrain that isn't smooth or even. And so you're going to need your full knee bending. And here's the thing is, if you have trouble bending your knee, there's a few factors that are going to influence this. One is, let me get the massage gun. The first thing, and the factor that's most influenceable, that you can change, that you can modify, is you probably have a muscle imbalance where your quads here are too active. And because your quads help you to straighten out your knee, if your quads are too active and they're shortening, they're not, the quad doesn't want to lengthen its full amount. It has to lengthen in order for you to bend your knee all the way. I can't tell you the number of times that I've seen somebody live in person here at my clinic, and I've just massaged their quads, and all of a sudden they get more knee motion. Not even touching the joint. I merely massage the quads. And so you can do that with a massage gun like this by just hanging out over the muscles. Find the tender spots. You'll find one where you just move around like this, and then you'll say, ooh, that one's tender, and then hang out there. Just keep the massage gun there. Apply mild pressure, maybe moderate pressure if you can take it, and you'll find that spot that was tender starts to melt away. It's not as tender anymore. It's not as hard if you poke on it, and then that's how you free up motion in here. You can then find the next spot. Usually people have a few spots, 3, 4 to 5 spots or more. Find the next spot and hang out there and essentially tenderize it, massage it away. And then after you do this, you should feel like you can bend your knee more. And you don't need to use a massage gun. They sell tools that are long. They look like a rolling pin. And they're rolling it on themselves like this. We have one somewhere. I'll see if we can find it. But that works too. You can use your hand, your knuckle to get in there and just loosen up the muscle so that it can lengthen properly and allow you to bend all the way. That alone might get you to bend your knee more. Now, the second thing, you might need we found the massage stick. This is what I'm talking about when we talk about the rolling pin device. This is intended to massage your body. So you use it like this and you roll out a knot. You roll it all over your thigh and you can find a spot, and then you just hang out there and massage it loose, find that tender spot and give it a 30 seconds to a minute. It doesn't take long. You don't have to massage yourself for 30 minutes. I tell people don't spend more than 5 minutes doing this. What's more important is that you do this frequently, because if you have the imbalance that I'm talking about where your quads are overactive, as soon as you get up and go walk and do stuff, you're going to be using your quads again. And you're going to get those spots to shorten up where it gets tender. And your whole muscle is going to shorten up as a result. You have to be working on your glute strength simultaneously so that you're not overusing your quads and getting your quads to shorten up again. And then you don't have to rely on massaging it with any tools like this or your hands. There's different tools. It depends what you prefer. This is generally going to be cheaper than one of these. This is a device, a machine. This is just it has this rolly thing on a bar and some handles on the side. These will run you anywhere from $10 to $20. Maybe a high-end one will be $30. These will be anywhere from $30 to $100 or hundreds of dollars. This one was probably about $50. And it just depends on what you want. I like this because it's low effort. You just push the button and go. But that's thing number one. Number two is actually moving your joint. And that's going to require help from a specialist. Somebody who can put their hands in the right spot, free up the kneecap, free up the shin bone. When I do this to people, I am visualizing what the bones look like and making sure that I get all the motion. And doing this, I can usually free up another 10 to 15 degrees. As long as there's no permanent changes inside the joint. If there's permanent changes inside the joint, my hands-on work will not make much of a difference because there's just biomechanical problems here. Julie says, can I get my ability to bend my knee back? Yeah. So it just depends on how well you can get the muscle to free up and the joint to free up. And if you try both, then chances are that's going to be your max. That's all you're going to have. We have that happen to some people where we've done the massage work, we've done the joint work, and they max out at a certain number, and we have to tell them that's what you're going to live with. But it might be enough for you to do everything you want to do. And if it's a little bit less on your other side, I'd take it. At least you don't have to have surgery. Hope that helps there. Mike Music, I know you, Mike. Hey, Mike. He says, what Dr. David is saying is true. My knee was so flared up this summer. After I followed his arthritis recovery program, my pain lessened. Now I am walking normally again. Good job, Mike. So happy for you, Mike. I'm glad you're walking normally again. It comes back to fixing the imbalance, and that's what Mike has done. He's gotten the glutes to work while he's walking, and as a result, he is feeling great. Kimberly says, so true. Keeping those muscles strong to avoid surgery. That's what I did. It works. But then I broke my hip. Sorry, Kimberly. Listen to Dr. David work those glutes. And Kimberly, it probably allowed you to recover from the hip injury faster. We see this all the time where people get stronger going into a surgery and they recover so much faster than people that didn't do anything, that they've been very weak. And the doctors will tell you themselves, the surgeons, they'll say things like, if you can do rehabilitation before you do a procedure, in other words, you get stronger, you just recover better. The tissues heal better and faster. So for those of you guys that are considering having the knee replacement, and maybe you're watching this and thinking, I'm not going to do that. I'm going to, I'm paying attention, but I'm not really going to do any of this stuff because I'm going to go have my procedure. That's fine. You might really need it, but I would encourage you to still work on the right muscles, on the glutes, because if you have a month or two or more leading up to your surgery and you can begin to get active in the right muscles, you're going to make the aftercare after your surgery so much easier. Tremendously easier. Even if you have like 3 months, that'd be the sweet spot. That would give you adequate time to loosen up the joint, get the tissues around there, the muscles, ligaments, everything moving well, so the surgeon has less problems to deal with during the surgery, and then you have a much faster recovery. And who knows, maybe you'll actually feel good enough to even cancel your surgery. That would be very nice. Cynthia Sunflowers says, why did one surgeon tell me I have bone on bone in my knee recently, and the other doctor told me my arthritis is moderate, but not bone on bone? I love this one, Cynthia. This is so good. This goes back to what I was talking about at the beginning. An x-ray is a picture of your knee. And if I take a pane of glass, Cynthia, and smash it up against your face, and you look like this, and I take a picture and I say, hey, everybody, meet Cynthia. And everybody's looking at you like this, they're going to think, wow, Cynthia looks like this. But then if I took that pane of glass off and took another picture, and then I showed them that picture, they'd say, wow, Cynthia's an amazing looking person. She's beautiful. How you take the picture matters. When you take the picture matters. Or if I took a picture of you, Cynthia, first thing in the morning, before, like as soon as you pick your head up off the pillow, you haven't had a chance to fix your hair and make yourself look presentable, versus 2-3 hours later, after you've gone through that process of getting yourself ready, you're going to look like a different person, very likely. If you've been working on getting your quads to relax and your glutes to become stronger, I think that you're going to have a different looking x-ray. And that's why one surgeon might be telling you that you have bone on bone knee arthritis one day, and then later on that it's actually moderate to mild. We can speculate and say, well, this surgeon's trying to get you to have surgery, and maybe the way they did the x-ray was an issue too. I think at the end of the day, Cynthia, if your knee is moving decently well, even though it hurts, if your knee hurts, that's fine. I understand. But if both knees can bend a decent amount, maybe you have a little limitation in one, this one can't bend as much as the other one, but they can straighten out and bend a decent amount, then you have a functioning knee joint. It works. And even though it looks bone on bone in one of the images, you probably don't need surgery. You probably just need to get the muscles in the right balance, and you'll likely get your motion back. And even if you don't get the full motion back, but you have enough to do most things, and it doesn't hurt you anymore, you can walk all you want, that, in my mind, is a cure. You've cured knee arthritis, and you're not going to deal with it anymore because you've gone through the process of fixing the imbalance and you know what to do. You're a different person now. So good question there, Cynthia. That's why you'll get different results from different doctors. Rebecca Heller says, do you think if having knee pain, one should go back to a doctor first, get an x-ray, or is it okay to go straight to PT? Good question, Rebecca. Part of this depends on where you live and what the laws and rules and traditions are. I can tell you most places are going to require like because of insurance or because of how your healthcare system works, they're going to require you to go to a GP first, like a general practitioner, a general doctor, a family doctor, depending on where you're from. They'll have all those names. It's your doctor that handles kind of all the basic stuff. Then that doctor will refer you to a specialist. They triage, they send you to the right person after that. It might be an orthopedic doctor or an there's different names, orthopod, orthopedic surgeon, orthopedist, knee doctor. They all have different names. Or they might send you straight to physical therapy in some cases. But if you go to the orthopedist, the orthopedic surgeon, that person might send you to the physical therapist. You probably could in many places just go straight to the physical therapist and work with them, but it's going to depend on if you need a permission from the doctor. There's just different variables. The best thing to do here for you, Rebecca, is to just ask. You can call up a physical therapist office and just say, hey, what's the process for coming in? Do I need to get a note from a doctor? Can I just show up? Do I need to talk to insurance companies first or whoever's paying for the healthcare? If you're paying for yourself, that helps a lot because you could probably just start working with them right away. So it really just depends on where you live and you doing some research. Mindy Gross next says, can knee arthritis and inflammation cause the foot toes to turn in? Whew. Not directly, Mindy. The toes will turn in. So there's different, I wonder I hope you can tell me more, but if you look at the toes here on my skeleton model, I don't know if you mean curled, like hammer toes, like where the toes want to do this, or like where they drift to the side. Like sometimes you'll get one toe that drifts over another toe. Either way, when you have changes in the toes like that, that's usually associated with weaknesses in the toe muscles, the ones that curl the toes. That weakness in the toe muscles is one of the imbalances that causes the arch of the foot to not be well supported because the toe curling muscles, they run under the main arch of the foot and they help keep the arch up. So if you have a fallen arch, then you have weak toe muscles usually. And when that arch falls down, it tips the ankle inwards, which then shifts this whole bone. It's a chain reaction, and it changes the pressure at the knee joint up here by my eyes. This is why I've included this in my knee arthritis recovery program, because for some people, especially if they have very weak foot muscles, it may be the thing to focus on. If you have a history of like bunions, hammer toes, you've had pain in the middle of your foot. Like this is a problem that I had. I was a runner and I had a lot of cuboid problems. This bone right here, I had pain kind of in the middle on the outside of my foot, and it was related to weak toe flexors. And I started to work on my toe flexors and got them really strong. I no longer have foot pain. And guess what? My knee pain got better as well. So take a look at that, at those toe flexors. And by the way, we have phase 1 of the knee arthritis recovery program completely free. It's available on our website. If we can show the website, there it is right there. Phase 1 of the knee arthritis recovery program does not require you to purchase it, and you don't have to set up a login. It's just on our website. You can just go to that link right there, and you can hit play, and the videos are right there, and start going through all of phase 1, so that if you want to try this out, if you want to get more information, see what the program's like, you can begin to do so. Now, in the knee arthritis recovery program, there's a lot more that comes with it. We have a ton of accountability. We have weekly group coaching calls. There's a community where you meet other people that are like-minded. They're all trying to avoid a knee replacement and go through the phases and fix the muscle imbalance. And so you see all the chatter that happens with that. Tons of encouragement. We have we have monthly challenges within the group. And then we have tests for the program as well. So as long as you show up and do what we recommend to you in the program, chances are you're going to fix this imbalance and you're going to avoid a knee replacement surgery and feel tremendously better along the way. So I encourage you to go start phase 1 for free and see if this is right for you. Let's answer another question here. We have Komisky2, who says, my biggest question is, how do you stop re-injury? I am working out the glutes, but also climb. How do I enable movement for high steps while making sure the knee doesn't cause more bone spurs or lockups? Good question. The first thing that comes to mind is if you're running into re-injury all the time, then you're likely not done fixing the imbalance. And for most people, fixing the imbalance it's a never-ending process. It's like cleaning your house or brushing your teeth. Like there's always maintenance involved. Now, if you just had a party and everybody came and there was trash left behind and things were spilled, it's obviously going to be a lot of work to go through and clean everything. But once you've got everything mostly cleaned and organized, then it's just maintenance work. And it's a similar concept with fixing the imbalance. Once you go through the process of getting the right muscles to activate, getting them stronger, using them in everyday activities, then you're just doing the maintenance work of keeping them strong. My hunch is that you haven't gone through that yet if you're still getting re-injuries, because people that get to phase 4 of the knee arthritis recovery program, even in phase 3, they're already saying, I did this thing. I walked through 3 stores, huge stores, department stores, and I usually would get pain after 1, and the holidays came in, so I had to go to 3, and I felt fantastic. I was surprised that I wasn't hobbling afterwards or had to get the electric scooter out to finish going to the last store. Things like that happen to people as they're going through the program because they're fixing the imbalance properly. They're going through all the steps like I've laid out in the knee arthritis recovery program. So that's part of my thought here for you, Komisky, is you need to go through the process properly. I know you're working out your glutes, but there's levels to this. There's things you have to progress to, and it's not you just being able to activate your glutes is level 1. You have to eventually get to being able to do a little bit of weights consistently using your glutes, and it's usually a lot more exercise than people think. Consistently, people get into our program and they say, wait, you want me to do this hourly? And I tell them, yeah, every hour, as best you can. You want me to get them that tired? I'm like, yeah. Because no other healthcare professionals are pushing you that much, you're not gaining the strength that you need to not get the flare-ups that you keep running into. So we need to do it this much. You want the outcome, Komisky, and everybody else listening, of not having any more knee pain, right? Pain's going to happen, but if we can reduce it to small amounts of pain that are manageable and don't ruin your day, ruin your week or month or year, and it's not coming back over and over again on a consistent basis, every week, every month, that kind of thing, then we won. And if that's the goal, then we need this much effort. And I push you through that in our program. Now, climbing, let me make sure I read the comment right. I am working out the glutes, but also climb. How do I enable movement for high steps? Yeah. See, you want to do a lot of steps here. And my thinking is you might not be ready to do those steps. You might not be ready to, if you're re-injuring yourself, you're pushing your body beyond its current capacity. The bone spurs and locking the knee joint, that's a sign that the bone spurs may never go away. Let me just say that. But knee joint locking is a sign that your imbalance is still very present, or your joint is just so far gone. In other words, it's had some permanent changes that you might encounter locking on a consistent basis. But we've seen people that had severe locking on a decently consistent basis. We tell them you might be a candidate for surgery and might not work out in this program, but they'll go do our phase 1 for free and get improvements. And then we tell them, all right, let's let you into the program, and they'll work through phase 2, 3 and make it to 4. And they lose the locking. The locking goes away because they fix the imbalance properly. So I encourage you to go check out phase 1 if you haven't yet, and give it enough time and relook at how you're doing everything, Komisky, to make sure that you're going through correcting the imbalance, the muscle imbalance, appropriately. Let's see the next comment here. Jennifer Kate says, how do we strengthen our glutes? Good question here. That's a loaded one for sure. Can I demonstrate some stuff here? All right, let's do a little demonstration. I'm going to take you through a quick glute progression so that you can see what I mean. First thing you want to do is, thank you, make sure that your glutes can activate. So whatever position you're in here, Jennifer, whether you're sitting, standing, or lying down, I'm sitting, activate your glutes. Just tell your brain to make your butt muscles tighten up. That's step one. If you can do that successfully without your thigh muscles taking over, then you're clear to move into the next part. But if you're not doing that successfully, if you try to tighten up your glutes and you feel your thigh muscles are just working hard, you need to just pause here, stay here. And the work that you have to do right now is hourly or every half hour even, think to tighten your glutes to the level, to the percentage where your thigh muscles don't activate. In other words, if you're activating at 100% back here, you're going as hard as you can, and you feel your thigh muscles engage, back down to 80%. Try to only tighten 80%. Find the percentage that your thighs don't activate at. That might be at 60 or even 20%, maybe even 5% or 1. But once you find where you can activate your glutes without your thigh muscles taking over, hold it for 10 seconds so that you start to wake up the cells in the muscle, in the glute muscles, because they're dormant. They haven't been working. A few of them have been working, and all the rest of them have just been taking a vacation. And those dormant ones need to wake up. The ones that have been there for you, the ones that are working in your glutes, the cells, when you do a hold, you send a nerve signal down to those muscles, and those muscle cells start to nudge the neighboring glute muscle cells, and tell them, hey, she's making this work now. We got to work. After you do holds for a while, some people it takes days. For some people it takes weeks of just holding the muscle and working up from 1% glute activation to 20% to 50%, eventually to the upper 80s and 90s without the thigh muscles working. You have to go through that process. And for some people, that's a while. Only after you complete that can you actually do traditional glute exercises. And the first one that I would recommend is a bridge, to where you're lying down like this and you're tightening your glutes first. That's why you have to go through all that. Then lifting up a little bit. And you still have to be very careful that as you lift up, you're not using your thighs here. You have to be very conscious and very deliberate about doing this bridge with the glutes being the most active muscle group of all. Because what most people do that don't get the glutes to work is they come up and they're using their hamstrings back here, the back of their thighs, and they're missing the glutes. And because those hamstring muscles cross the knee joint, I'll show you, they start up here in the glute area, hamstrings come down, they attach to the sides of the shin bone right here, which means they cross the knee joint. They're in a position to where if they're overactive because your glutes aren't doing their job, you're doing a bridge exercise and it's all hamstrings, then they're going to compress the knee joint. They pull the shin bone up into the thigh bone and add more pressure into it and feed into the knee arthritis problem, the pressure problem inside the knee joint. It's smashing your knee joint. So we cannot do bridges with the hamstrings being dominant. It's okay if they work a little bit, but your glutes should be the muscle that's working the most. After the bridges, what I like to take people to is a standing mini squat. Can I show that? So in a standing position right here, you have to have good glute activation. You need to be able to fire your glutes in standing. So right here, I'm relaxed, and then I tighten my glutes right here. And you can see how my hips go forward a little bit. That's okay. My knees stay slightly bent. They're kind of loose down here. Just in standing, I'm tightening my buns here, and I'm focusing on not tightening my thighs too. Because if you lock out your knees like this, these muscles in the front are working. So you have to keep them slightly bent while keeping these glutes back here active. Then to do the mini squat, you're just bending your knees slightly more while maintaining your hips forward. What most people do when they do the mini squat is they stick out their butt this way. They think this is a squat when I'm telling you to do this is a squat. My hips are forward. So when if we start in the wrong squat, they bend their hips right here. They do what's called a hip hinge, which I don't think we should be worried about hip hinges. Controversial. A lot of people think hip hinges are huge deals, but really they don't always get your glutes to activate, because in order to get your glutes to activate, you have to bring that hip hinge forward into a hip thrust. So when you can hold this hip thrust and you feel like your glutes are most active, now you're working your glutes. You're truly working your glutes. Then after you've done holds like this, because the whole time you should be doing holds, only after you're super confident that you can consistently activate your glutes every time you do a little mini squat like this, and you're not tiring out your thighs, you're not hurting your back, then you can start doing reps. You're coming up and down, up and down. But every time you come down, you should feel your glutes working here a bit because you're pushing your knees out. See, it's another key part here is you have to widen the knees, because as soon as you bring the knees in like this, you're going to activate the quads. But if you push those knees out and push the hips forward, you're going to activate the glutes back here. Key thing. Now, let me just stop there here, Jennifer, because that alone, working from glute activation to bridges with a focus on glute activation to then mini squats, holding the mini squat, and then just doing reps in a mini squat. I didn't even go all the way down, like where you're bringing your bottom all the way down towards your heels. You're just activating the glutes in a mini squat. That helps people tremendously. For some people, we're even progressing past that. In the program, I show you how to use weights and do deadlifts and do squats, and all that could be helpful if it's right for you. But some people, they hit phase 4, as far as the criteria. Here it is. They'll hit these phase 4 criteria where they don't have any swelling. It's been over a month. They don't have any pain at night. They can be on their feet as long as they want, 60 minutes or longer, hours usually, and then they can flex their glutes in all activities. They're phase 4, and they never had to lift a big weight besides like a 5 or 10 pound weight. Very, very doable for most people. We're not asking you to pick up hundreds of pounds. You can work your way up to that. There's room for that in this program if it's right for you. But we have a lot of females here that don't like to lift weights, and picking up a barbell, like one of those big bodybuilder bars, you don't need to do it. I show you in the program, but you can get by just fine with the pink weights, the little ones, and heal your knee arthritis. Oh, we got Daryl Hollinger, who gave us a super chat. Thank you, Daryl. I appreciate it. My whole team appreciates it. It keeps us going here for sure. Appreciate that, Daryl. Faith Jur says, what do you think about air compression leg massage? I've not heard of air compression leg massage. We'll have to look that one up. But if it's what I think it is, they're basically massaging you using air, compressed air, as long as it loosens up the muscle. You know, going back to the massage gun, can I borrow it real quick? And you know, the rolling pin, we don't have to have the rolling pin. Oh, I see she's showing me a picture here of the air compression massage. Got it. So it's not, if it's those big sleeves that you put on your legs, I'm okay with it. But what I would be worried about is if you have a knot, if you have a tender spot right here, you maybe can't target it with those big sleeves on, but you sure can with this. You don't even need that. You can get your knuckles in there and loosen it up. And that's going to be a much more effective use of your time. Now, I'm not against you putting on those big leg sleeves and using the air compression to massage your legs if you feel better, but did it accomplish loosening up your thighs right here so that you could bend your knee more? Not only is it important for knee bending, but if you can relax that muscle because you targeted it specifically where the knots are, where the tender spots are, it sets up your glutes to work better, because when you go to consciously activate this muscle back here, if that's a struggle for you, then you're going to want to fire your thighs. The shorter and more active your thigh muscles are, the quicker they're going to activate when you go to try to do anything that involves your legs. But if you've relaxed the muscle, then you have a better chance at firing this muscle back here, and this one not taking over so quick. So that's why I really like this massage gun. Not against the air massager. You can try it out, see if it gives you the same effect. You just need to understand and know what the goal is here. That's why I have these principles that I explained to you today. Great question. So now, Bella, was it Renee? I think it was Renee. She says a right glute. It's because Bella, I think she had a different name. Right glute is tight. My right is okay, but needs work. How do I balance them? Oh, I love this one. Can I come to the board? Let me draw this out, because I get this question a lot about, well, if my left glute doesn't work as good, it feels weaker, and my right's stronger, do I just focus on the right? And here's my thought on this. if you have one side of your body, which this happens all the time, by the way, like people have one side that's weaker than the other. If this is your left side and this is your right side, we're talking glutes, for instance. It's the most common one people ask me about. If your right side's stronger than your left, we'll say it's a 8, and your left side feels like it's a 6. If you currently have knee arthritis or just knee pain in general, and you need to pass this level, this is your threshold. If you get strong enough to pass this level, and then your knee pain goes away, because there's no way to know these numbers. I'm just giving you these numbers for the sake of the illustration. But if you can just get them both up, if you can get this to a 10 and get this one to an 8, you're above the threshold and your knee pain is probably going to go away. And if you can keep going, if you can keep getting them both stronger, you move further and further past the threshold. So the idea here is just work out both sides. It makes things way easier. You will get them both strong. And truth be told, even when you're very strong, like I can deadlift 400 pounds. I was in the gym yesterday deadlifting, and I could feel my left glute doesn't activate as good as my right. It activates, it works. I did all my exercises. I feel it today. I'm sore. It's good. But I was feeling my left not working like my right. But I'm above the threshold here, and I don't have any knee pain or hip pain or back pain or foot pain. I'm feeling great. So just work them both out. Because if you spend time just working the weak side, you're missing out on the opportunity to bring up the other side. And usually the way the body works is you're not going to be symmetrical always. Chasing that symmetry is like chasing perfection. I mean, like I have asymmetries. I have this pointy tip on my ear right here that's not on this side. You probably have asymmetries too, Renee. Everybody does. Shoulders dropped on this side versus that side. My finger has this weird thing on this side versus that side. One of the things that my family makes fun of is I have this line that goes all the way across on my hand right here. It's called the simian crease, but it's not on this side. This is more normal where the lines don't connect the way they do on this side. So we just have asymmetries. We're not symmetrical perfectly, and I think strength is part of that. Good question. All right, next up we have Terry. She says, Dr. David knows what he's talking about. Hey, Terry, I hope so. I think so. I need you guys to let me know if this works for you. That's how I know. Faith Jur says, thank you for all you do. You're welcome. I'm so glad. Are we wrapping up?
No, we got more.
We got a few more comments. All right. I just want to make sure I'm not in trouble with anybody here. SV Harkin says, I'm a cyclist. Does that help glutes? Good one. It depends. Are you using your glutes when you cycle? I'm a cyclist too. I ride a bike to and from work. I ride around miles and miles sometimes. And it is possible for you to cycle and not use your glutes very well, to use your quads more. In fact, that's what usually happens. And so if you can switch from quad dominant cycling to glute dominant cycling, then cycling is great for you. And it can actually be helpful for your knees. There's this thought that, and it's founded in research, that cycling will help knee arthritis. And the reason behind it is because a lot of low resistance movement in the knee joint circulates the fluid inside the knee, which helps the cartilage heal. That's true. In fact, I tell people to do an exercise called tailgate swings all the time, where they're not cycling, they're just swinging their legs back and forth, like if you're sitting on the back of a truck or the tailgate of a truck, and you're just getting the fluid to circulate. However, when you're cycling, there's a little more resistance in that, sometimes a lot more resistance, but you're using muscles forcefully to pedal. And those muscles over time, over the minutes, hours potentially that you're cycling, can strengthen those muscles that you're using. And if it's quads that you feel getting most tired, then you're strengthening your quads. But there's a way where you can push down on the pedal to move the bike and use your glutes more. And you just have to figure that out. You have to think, all right, tighten your glutes when you push down. And then, of course, then the other side, then tighten the other glutes. And then if you can make it glute every single time instead of quads, then cycling is helpful for you. But this doesn't get taught. So many people get sent to physical therapy and they just get sat on the bike at physical therapy and beep, 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 start. And they don't get any instruction on which muscles to fire because it's not their specialty. If you had surgery and you have enough motion in your knee to make it all the way around on the pedals, then generally the goal when they're getting you on a bike is just to get some general movement in the knee joint, not to fix an imbalance. But if you're beyond that, if your knee motion's okay, now we're trying to fix you, prevent you from having a surgery, we're just trying to get the pain under control, then we shouldn't be cycling for pain control. We need to be training the glutes to work right so that when you jump on the bike, it's glute dominant, then you can actually help your knee joint. Hope that helps you there. Who's next here? Got a few more comments. Sure thing, sure thing. Thank you guys for being on here and asking so many great questions. We got Valerie again. She said, I had a tibial plateau fracture in May. Oh, I'm so sorry, Valerie. Today I can walk stairs. A doctor says to have to take meds. It's getting worse for me. That's why I'm following Dr. David. He's a great helper. Aw, that's tough. So tibial plateau fracture, let me show you real quick. Just because if you've had one, because these happen every now and then. This is the tibia, and this is the top of the tibia. That's the tibial plateau because it's generally kind of flat. So if you had a break that involved that area of the bone, because that's part of the knee joint, it is going to potentially accelerate knee arthritis. But for you, Valerie, you've got to make sure you fix the imbalance, get the right muscles stronger, the glutes, the feet, the toe curls, lower abdominals, so that if you have an issue that's going to affect your joint, the way the bone healed, you're minimizing the pressure through there, and you're setting yourself up to not have knee arthritis in the long term, or minimize its effects. Just be careful in how much you walk, how much activity you're doing. It's very possible. I've treated people with tibial plateau fractures who have had ongoing knee pain, and they've gotten completely painless despite them having like rods or wires in there to hold the joint together, because sometimes it's like a car accident where the bone got shattered, or some injury where there was a severe problem that happened that required surgery, and the knee joint's not the same anymore. But it's possible to get back to doing everything you can actively and enjoying it. But you've got to fix the imbalance. Good question. Blaze GN says, hi from Ontario, Canada. I follow your podcast and the exercises for knee arthritis. Glutes are slowly getting better. Awesome job, Blaze. Great job. Thank you for letting us know. That gives me good feedback there that we're on the right track here. PDKJV 1611 says, it takes a lot of routine, disciplined exercises. I've come a long way. At 68 years old, I could hardly walk. I was using a walker. Now I'm off the walker. Good job. Still struggling, but still working at it. Yep. That's fantastic. I'm glad you brought up the walker, because the walker can help tremendously to take pressure off, especially when you're in phase 1 of our program. Think about it. You're in a lot of pain. You might potentially be swelling 4 to 7 days a week. You might have pain at night 4 to 7 days a week. Can't be on your feet for very long. And if you have these criteria, it helps to get on a walker or some crutches or at least a cane, because then you're not putting as much pressure through your knee joint and aggravating it. And so it helps you to begin to calm things down. And that puts you in a position to then work on the muscle imbalance, to fix the muscles in the later phases. But if you can't get that pain under control, you have no business working on your glutes yet. You need to first get the pain under control. So good job getting on the walker. We have people on our program that fight it. They don't want to get on the walker. They keep thinking they can just muscle their way through this, work on the exercises, and I tell them, you are taking way longer than you should because you don't want to get on the walker. Just get on it. But I get it, because you have to face all the social pressures and everybody asking you, what happened? Oh no, they're getting worse. And why are you on the walker? Do you need help? And you have to go through it. But if you just go through it, it might just be a few weeks of you using the walker versus the rest of your life, because you had the knee replacement and you're having trouble with your knee after that. And it was replaced. It was permanently changed. So I'm a big fan of let's go through it. Let's go through the month of using the walker so you can get off of it for the rest of your life. Next question says, lovely Jubby. Lovely Jubbly. I love that name. I don't understand why more doctors are not giving this advice instead of doing surgery. I can tell you, Lovely Jubbly, it's not their training. Doctors are trained on medications and surgery, not on how to prevent problems. They go to school. I mean, they're doctors of medicine, MD, medicine doctor. They know medications like nobody's business. I mean, they're pretty much like a pharmacist. Pharmacists probably know them a bit better. A lot of doctors probably know as much as pharmacists, though. So they look at treating your problem with medications. What injections can I give you? What medications by mouth? How can I take your pain away or alleviate your pain? There's no cure for knee arthritis that is going to come from a pill. Then when it comes to injections, same thing. They're just injecting the medication in your knee instead of you swallowing it and having to go through your entire bloodstream and your digestive tract. Orthopedic surgeons who do knee replacements are going to school for learning how to make sure that you don't get an infection and that the mechanics of the replacement work right. They're dealing in terms of extreme situations where there's no going back. This is a far gone problem, and we can't rehabilitate this knee naturally anymore. But not enough people in the medical field are focused on my specialty, which is how do we avoid the knee replacement by addressing the knee arthritis before it becomes worse. And you absolutely have to have a surgery. It's just not taught in schools. And part of that reason is because there's not a lot of research behind it. From my perspective, we're in the Stone Age when it comes to medical research. There's a lot that we don't know. We don't know. There's a lot of advancements. The knee replacement surgery itself is pretty amazing. It's incredible. And if you have to have it done, it's actually we've done it long enough to where people are lasting longer with the knee replacement, but there's still people that have pain with the knee replacement. There's a lot of people that are unsatisfied. The common problem that I see with people that have knee replacements is they're overall better. They can bend their knee more, straighten their knee more, they can walk for longer, but they have this low level of discomfort in their knee that they're not happy about. And they don't know how to deal with it. And they just acquiesce. They just give up. They just say, well, this is how it's going to be. And if they went through fixing the imbalance, like I was talking about here, they probably would never have to have the surgery. And even if they have had the surgery already, they could probably improve the knee pain. But that's not common knowledge. So I hope to bring it to you guys. If you guys can help me by sharing my information, with friends that are dealing with problems, your medical providers. We have physical therapists and doctors that follow us and ask us questions, and the light bulbs go off and they're like, wow, this makes sense, but I need your help. So I'm doing the best I can. We're trying to grow as fast as we can and share this information, but we need you guys to try this stuff and give us testimonials and reviews and share out there that this stuff really works. So that's why Lovely Jubbly. Mindy Gross says, I think I need to get a tattoo that says glutes. I love it. I love it. We have some fun stickers that we have for our clients here that say, I think it's what's on the back of my shirt. Is that what we have a sticker on? But don't forget the glutes. This is your tattoo right here, Mindy. I would love it. If you ever get that tattoo, oh my gosh, I need to meet you in person and take a picture with you because that'll be so much fun. We're nearing the end, y'all. Almost there. Lovely Jubbly says, thank you, Dr. David, for all your help. All right. Awesome advice from Myers Arm Wrestling. Oh my gosh, I love the picture there. Myers Arm Wrestling. Glad to help you out. I hope your knees are feeling fantastic. Lakesh Miangelis. I can't pronounce it. Hi, Dr. David. I've had meniscus injuries and it gets better when I'm disciplined, but then again, it gets bad. Pain as I bend it when I walk, so it makes it very painful to walk. I think you answered your own question there. You need to be more disciplined. Is the pain not bad enough for you? I mean, do you need me to tell you that the meniscus is going to turn into the torn meniscus, the meniscus injury eventually turns into arthritis? That's what you're signing up for if you don't fix it now. So many people that have had knee arthritis have also had a meniscus tear in the past because it's the same muscle imbalance that people have had for decades that led to the knee arthritis problem, which then they end up getting a knee replacement for. So you're lucky in my mind if you have a meniscus tear right now, because it's a sign to you. It's your body telling you, fix me. I have a muscle imbalance. Fix me now so it's not worse later. Fix me now so I can walk in my 70s and 80s and beyond. Go fix this problem. The alternative is let it fester, let it just worsen, and then be okay with having knee arthritis later and then having a knee replacement later on. It's your knee. So hopefully you take care of this problem. I can read Spanish, yeah. Hizo todo lo que usted enseñaba y estoy muy bien. Gracias. Oh, so Amelia Morelia says, I did everything that you showed me and I'm much better. Thank you. Awesome. I'm from El Paso. I'm Hispanic and I know Spanish very well. So I appreciate that comment. Thank you, Amelia.
One
Last comment. Here we go.
2 parts.
It's a 2-part comment. We got Sharon Lamati. I have really gotten better from doing your exercises. Awesome. I still have a way to go, but can walk normally up and down stairs now. Torn meniscus 5 months ago. My surgeon said if I was his sister, he would tell her to do what I'm doing. Oh, that's awesome. So I hope share our channel with your surgeon. I hope that they can learn about what we're doing and pointing people in the right direction. You know, even if it's not our videos, as long as they get better, that's what I care about, that they're fixing muscle imbalances and not chasing treatments that are going to leave them worse in the long run. Mike Music says, I tell everyone who will listen. Thank you, Mike. I appreciate it. Yeah, not everyone will listen. It's tough. And I get it because, you know, I'm a guy on the internet and your doctor might tell you like, don't listen to the internet. Don't listen to Google or YouTube. That's, you know, I'm here in person with you. And yeah, but what's their training? And are you actually getting better with their treatment? You got to do what works for you. Kit Kat says, you're genius. I am in your hip recovery program. Phase 3 after 3 months. In phase 2, I feel finally my glutes activate. Thank you. Awesome. Thank you for that testimonial, Kit Kat. All right, guys, with that, we're going to wrap up. Thank you for joining us. We'll be here live next Tuesday, ready to answer some questions and help you guys out. Have a wonderful week. Bye-bye.